Have you ever felt absolutely trapped by a thought? You know the door's locked, you know you washed your hands, but there's this nagging voice inventing disaster scenarios, that constant, but what if, driving you to check again and again. It's exhausting. But what if the real answer isn't just gritting your teeth through the fear? What if the fear itself, that whole feeling, is built on, well, a kind of internal lie?
That's exactly the shift in perspective we're diving into today. Some really fascinating research suggests that the core issue in OCD, obsessive-compulsive disorder, might not actually be about anxiety tolerance. It might be a specific flaw in how we reason.
A flaw in reasoning. Okay. So, our mission today is to really unpack this thing called inference based cognitive behavioral therapy, ICBT. It's a specialized treatment, quite promising actually, that goes right after the source of that doubt. We'll look at how it stacks up against the usual suspects like ERP and standard CBT. And importantly, we want to pull out some practical strategies the research points to, things you might be able to use to start, well, trusting what you actually see and hear again.
Right. And to really appreciate what makes ICBT different, we need to set the stage a bit. Cognitive behavioral therapy, CBT, I mean, that's huge globally. It's the most practiced psychotherapy out there. And specifically for OCD, exposure and response prevention, ERP, that's really seen as the gold standard, the core of modern treatment. You see large effect sizes in the big studies, the randomized controlled trials. It works for many people.
But there's always but, isn't there? ERP, while effective, it's tough. It can be really challenging, even aversive for some folks. The research actually shows that the fear and anxiety it stirs up, that's why over a quarter of people drop out in some studies. And here's the kicker, even with ERP, maybe only about half the people treated for OCD get that really significant clinical improvement everyone's hoping for. So clearly there's a need for other options, maybe ones that aren't quite so intense.
Exactly. Think about the standard OCD cycle. You have the obsessive thought that triggers intense distress, which then pushes you towards a compulsion or avoiding something, and boom, short-term relief. But the cycle continues. ERP basically tries to break that chain at the compulsion stage. You expose yourself to the trigger, you resist the urge to do the compulsion, and the idea is the anxiety will eventually decrease through habituation, or maybe new learning happens. It's primarily targeting the anxiety.
Okay, makes sense. So now let's pivot to ICBT. You're saying this is different, developed specifically for OCD, and it attacks the doubt itself, not the anxiety that follow.
Precisely. The core concept in ICBT is something called inferential confusion. It's basically a breakdown in reasoning where someone starts confusing what's merely possible with what's actually real. They end up relying way too much on their imagination, almost trusting it more than their own senses, their eyes, their ears.
Huh. So OCD, from this perspective, is like you're trusting an imaginary what-if story more than the real-world evidence right in front of you, like with locking the door. You see it lock, hear the click.
Exactly. You have the sensory data door locked. But then the obsession hits. And according to ICBT, that obsession in that moment is 100% imaginary. Why? Because there's zero direct justification for the doubt right here, right now.
Huh.
Your senses say locked, but then this faulty reasoning pattern kicks in. They call it inverse inference. You grab a hypothetical idea like, oh, what if the mechanism inside the lock secretly broke just as I turned the key? And you use that imagined possibility to conclude the door must be unlocked, despite what you just saw and felt.
Wait, hold on. So the feeling of doubt doesn't come from some tiny shred of evidence I missed. The doubt actually creates its own imaginary evidence.
That's the core insight. The reasoning process itself generates the doubt, completely detached from even contradicting observable reality. The initial what if becomes the conclusion, almost instantly.
Wow. Okay, that's a big shift. And if the obsession is just faulty logic, this idea that you might not need exposure therapy suddenly makes more sense. You're saying ICBT goes upstream, fix the logic, and the anxiety downstream just fades.
That's the goal, yes. ICBT focuses on strengthening your reality testing skills, your ability to trust your senses and common sense. It aims to correct that dysfunctional reasoning process that creates the doubt in the first place. If you can successfully resolve the doubt at its source, proving to yourself it's based on imagination, not reality, then the urge to perform the compulsion and the anxiety tied to it often just dissolves. There's no fire to put out anymore.
This really gets to the heart of it, the big headline difference. ICBT works without deliberately making you sit with intense anxiety through prolonged ERP. But how? If you skip ERP, how does the brain learn not to panic? I thought reducing anxiety was the whole point.
That's the crucial distinction. ICBT isn't really aiming for fear habituation in the same way ERP is. It's aiming for conviction, certainty based on reality, trust in your own senses. ERP is fundamentally behavioral. Do the exposure, resist the compulsion, extinguish the fear response. ICBT is primarily cognitive. It targets the obsessional doubt first. It helps you see why that initial inference, that what if, is invalid. Once you see that, the compulsion becomes unnecessary. And a really key finding from the research is that patients experience this as a non-anxiety provoking treatment. That's huge.
Okay, so it's not about anxiety reduction directly. How does it compare then to, say, standard cognitive therapy, CT? Isn't CT also about thoughts, like challenging how likely the bad thing is to happen?
Good question. There's a key difference there too. Standard CT often focuses on the appraisals or beliefs about the obsessive thought. So it might challenge an inflated sense of responsibility. Realistically, what are the chances leaving the stove on once will burn down the whole building? ICBT, critically, does no restructuring of the content of the obsession itself. It doesn't debate whether the fire is likely. Instead, it goes after the reasoning chain that led you to doubt the stove was off in the first place, especially when your senses told you it was. It asks what information, right now, tells you the stove might be on? None. Then why are we trusting this imagined scenario?
Right, it's about the process of doubting, not the content of the doubt.
Yeah.
What about ACT acceptance and commitment therapy? That's gained a lot of traction. How does ICBT fit with that? ACT is more about accepting the thoughts and feelings, right?
Just exactly.
Mhm.
ACT emphasizes cognitive diffusion, seeing thoughts as just thoughts and acceptance. It encourages you to sort of make space for the anxiety and the intrusive thoughts and still move towards your values. It's like saying, okay, anxiety is here, thought is here, but I'm still going to do what matters.
Mm.
ICBT takes a different stance. It aims for achieving genuine certainty within yourself based on reality. Trusting your senses, trusting your common sense. It argues the obsession isn't something to just accept and carry. It's an active distortion, a product of faulty reasoning that can be dismissed once you see how it's constructed.
And just briefly, how is this different from something like recovery-oriented cognitive therapy, CTR?
CTR is generally a broader approach, often used for more severe mental health challenges. It's very person-focused, looking at building positive beliefs, strengths, hope, purpose, aspirations. It's about building up the best self. While ICBT is quite targeted, really zeroing in on fixing that specific reasoning error in OCD, CTR is more about empowering the whole person, helping their strengths overshadow their problems. Different focus.
So the million-dollar question, does this upstream logic-focused approach actually work for OCD?
The research is really encouraging. Studies show ICBT is effective. In terms of reducing OCD symptoms, measured by things like the YBOCS score, the outcomes are comparable to traditional CBT, including ERP components. It holds its own against the gold standard.
Comparable effectiveness. But you mentioned something earlier that sounded like a potential game changer.
Yes, the tolerability. This is where ICBT really seems to shine in the studies. Participants consistently rated ICBT as significantly more tolerable than the ERP-based treatments. They described it as less exhausting, less distressing, less intrusive. For anyone who's found ERP too daunting or dropped out because of the anxiety, this is potentially a really big deal. It lowers the barrier to getting effective help.
Wow, less distressing and effective. That's compelling. And wasn't there something about how well it works for people with less insight, the ones who really believe their obsessions might be true?
Yes, that's another key finding. ICBT seems particularly effective for individuals with what's called poor insight or overvalued ideation. Those who have a harder time dismissing the obsessions as senseless. These individuals are often considered more treatment-resistant with traditional approaches, but the research suggests ICBT leads to significantly greater improvement in reducing that conviction, that certainty that the obsession could be real compared to other treatments.
Okay, so it's effective, more tolerable, works well even for tough cases. How is it actually delivered? Is it complicated?
It's quite structured, actually. Typically, it's delivered through a series of about 10 to 12 sequential modules, usually over around 20 weekly sessions, give or take. Each module builds on the last, systematically helping the person identify and correct these reasoning errors.
All right, let's get practical then. If someone's listening and this idea of faulty reasoning resonates, what are some core strategies from the ICBT toolbox they could start thinking about? How do you actually apply this upstream logic?
Yeah, there are some key skills. And they're all really designed to sharpen that distinction between what's real, based on your senses right now, and what's purely in the land of imagination, as the therapy calls it.
Okay, strategy one.
First is learning to spot the leap. The therapy teaches you to pinpoint the exact moment you jump from relying on your senses, what you see, hear, touch, into relying purely on imagination. That moment is the point of inferential confusion. So using the door example again, the leap isn't just thinking the door is unlocked. The leap is the specific thought process. Even though I saw and felt it lock, what if the internal mechanism somehow broke without me noticing? Recognizing that specific jump is step one.
Ah, okay, so it's about catching the process of inventing the doubt. What else?
Another big one is addressing the feared possible self. Obsessions often aren't just about the feared outcome, like a fire. They tap into a deeper fear about what the obsession implies about you as a person. Maybe it suggests you're careless or irresponsible or immoral or dangerous. The doubt isn't just, is the stove on? It's, am I the kind of person who would carelessly burn the house down?
Right. And ICBT helps you untangle that, separate your actual self from the OCD story.
Exactly. It helps you see your true self, the part of you that values safety and responsibility, which is precisely why the OCD latches onto these themes as separate from the OCD narrative that paints you as inherently flawed or dangerous. You start to realize, paradoxically, that having the obsession is proof you're not the feared self. The person truly careless wouldn't be tormented by these doubts.
That's powerful. Are there quick in-the-moment techniques?
Yes, they use reality sensing exercises. These are grounding techniques, but with a specific ICBT twist. A common one is the 5-4-3-2-1 exercise. Name 5 things you can see right now, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. The point here isn't just to calm down, though it might help. It's to actively, deliberately contrast the vague, imagined threat with the concrete, undeniable certainty of your present sensory reality. You're strengthening the reality muscle.
Makes sense. Grounding with a purpose. And what's the main homework? The core daily practice?
It's what they call the daily exercise for obsessional doubt. It's quite straightforward, but needs consistent practice. Every time an obsessional doubt pops up, you have to pause and ask yourself, is there any direct evidence or information available to my senses right here, right now, that justifies this doubt? If the answer is no, and with OCD doubts it almost always is, then you actively compare what the imaginary doubt says could be happening versus what your senses and your common sense tell you is happening. And then you dismiss the doubt because it has no basis in current reality.
That sounds incredibly direct, almost like arguing with the OCD based on facts. But I can see how someone might get stuck, right? Like, what if that reality check just becomes another checking compulsion, checking if the check worked?
That is the crucial warning in the research and in the therapy itself. It's absolutely vital to distinguish between doing a helpful one-time reality check based on current sensory info and slipping into a repetitive checking ritual driven by the need for 100% certainty about the past or future. The moment you start repeating the reality check, asking, are you sure? But what if I missed something? Well, you've crossed the line. You're no longer using the tool to dismiss the doubt. You're using it as a compulsion, which ironically just feeds the underlying doubt you were trying to resolve.
Right, that nuance is everything, and it highlights why getting professional guidance is probably key, especially when you're dealing with something as complex and sticky as OCD and trying a specialized therapy like ICBT.
Absolutely. Understanding the principles is one thing, but applying them correctly, especially navigating that fine line between a helpful technique and a new compulsion, often requires skilled support. That's where professionals, like the team at Edward Jenny and Associates, come in. They specialize in this kind of individualized support. They offer comprehensive psychotherapy, but also something called collaborative assessment.
Collaborative assessment.
Right.
What does that involve?
It's an approach where they use sophisticated psychological assessments integrated right into the therapy process. It helps get to the root of issues faster, identify those triggers and patterns driving the behavior, and really deepen self-understanding. It can help clients feel less stuck and move forward more effectively. They work with a range of challenges, definitely including OCD treatment, anxiety therapy, relationship issues, things like that.
And what's their overall approach like?
It seems very focused on the client-therapist relationship. They emphasize collaboration, drawing on the experience of their whole team, actually, and providing a high level of guidance and accountability. It sounds tailored. They offer sessions for individuals, couples too. They're based in West Grove, PA for in-person, but also offer telehealth across Pennsylvania, which is great for accessibility. Practically speaking, they accept traditional Medicare. For other insurances, they function as an out-of-network provider and give you the documentation, the super bill, to submit for potential reimbursement.
Okay, good to know there are resources specializing in these kinds of tailored approaches. So, wrapping this up, this has been really eye-opening. The big takeaway seems to be that ICBT presents a solid, evidence-backed alternative for OCD, one that doesn't focus on battling the fear directly, but instead strategically dismantles the faulty logic, the imaginary stories that generate the fear in the first place.
I think that's right. And perhaps the most compelling part, based on the research, is that it achieves results comparable to the gold standard, ERP, but seems to be significantly easier for many people to tolerate. It opens a door for those who found exposure too overwhelming. It offers a pathway to resolving the doubt, potentially without the intense anxiety spike.
So, a final thought for everyone listening. Maybe when you're wrestling with those intrusive OCD doubts, the most powerful shift isn't just trying harder to tolerate uncertainty about some imagined awful future. Maybe it's about learning to lean into and fiercely trust the undeniable, verifiable certainty provided by your own senses right here in the present moment.